Congressman Sessions, I have read the part of the House Bill 3200. On page 413, LEP, Limited English Proficiency, is addressed, where the healthcare bill wants to provide translators to every person who has limited English proficiency in this country. And it does say the last 3 words, and includes illegals. I talked to someone at the Fed Labor Department downtown, who actually, when I was discussing this with someone in the Tom Thumb, she taps me on the shoulder and said, I am the lady responsible for getting those translators in this area. A person needing French or Spanish gets $50 an hour during the day. But this is a 24-hour for every medical situation that can be thought of, whether it be the chiropractor, the pharmacy, in the hospital, whatever, that this bill wants to provide a translator. The exotic languages and dialects get up to $350 per hour during the day. There are 4 million people in the city of New York that do not speak 1 word of English. We are now thinking about bringing in more people through the illegals. How in the world, one, would we pull this off? And secondly, what is the implication to the addition of all the cost that has not even been addressed in any publication that I have read, of the enormous cost of adding this to the bill, instead of requiring people to know enough English to converse?
I appreciate the gentleman. In fact, the gentlewoman is correct, and I brought that up during the Rules Committee hearing to ask the question. In RISD, as of several years ago, there were 69 or 70 different languages that were taught that required different dialects and teachers in RISD alone. The gentlewoman has not undershot it at all. In all areas, from the time you come in, till the time you're with the doctor, till the time you're with the rehab person, till the time you check out, till the time you have your surgery, till the time of in your surgery, the entire process will be covered now by people who will be required for every single language. Once again, I would say to the gentlewoman, the weight of this bill will soon be understood by many. I appreciate the gentlewoman for bringing this up tonight, and I'm going to, in the brevity of time, I'd like to thank the gentlewoman for being here and thank her. I promise to have other town hall meetings, and I hope you'll come back. The gentleman's recognized.
I would like to address the issue of medical devices and the new taxes placed on it. I asked this question not on my own behalf, but my son, who is a neurofibromatosis type 2 patient, who will in the future probably need a auditory brain implant to have any kind of hearing at all. And right now, that particular field is advancing fairly well, but with this static care level, I am very concerned that not only is the pharmaceutical industry going to atrophy and either go elsewhere or quit innovating, but also the medical device area. Thank you.
The gentleman is correct. There is a massive tax on these new devices, which means we'll once again get away from new devices that are being manufactured. And it is a real crying shame. Once again, it is on purpose, not accidental. The gentleman is thanked. The gentlewoman's recognized.
I have a concern, and I'm addressing this to the doctors. My concern is that in the trauma units in this country, that they are filled with people who are not citizens of this country, and our citizens are not seen. Their lives are not being sustained. This is very personal for me. I lost my son here in Las Vegas, and they were unable to help him because the trauma unit was monopolized by by non-citizens. And I'm just wondering if in the future this reform is going to do this democratically in the trauma units.
I spend a lot of time at night working in the operating room, and I do see a lot of folks come through there that can't speak English, and we have to provide translators for, and most level 1 trauma centers and level 2 trauma centers are set up to handle multiple patients at the same time. I don't know the situations surrounding your son. I think once people, let me say this, the hospital that I just previously left has a massive emergency room set up to handle hundreds of patient visits every evening, and I fear that's still not going to be enough, because as people quit purchasing health care insurance and find that it's easier to get health care just by paying the penalty and showing up in emergency rooms, even the ones that we have now that are on health care insurance are going to find their way to the emergency rooms, and it's a very poor mechanism for delivering health care.
I thank the gentlewoman. The gentlewoman is recognized.
My question concerns participation in this new health care program, and it's under the guise, I guess, of all of us are created equal, but I'm wondering whether or not some of us are more equal than others. Specifically, the people, the Democrats that voted for these bills, the president, whoever else, judicial body or executive or Congress, is exempted from having to participate in this program. Rumors are rampant.
Yes, ma'am. For the sake of answering the gentlewoman's question, in fact, what happens is the writers of the bill exempted themselves. Leadership, yeah, it'd be funny if it weren't truthful. In fact, the leadership staffs and the committees have all opted to make sure that they do not have to participate. As I understand it, members of Congress and their staffs would have to participate. Also, as I understand it, and I get this, the bill was written so quickly that when they touched this section, they failed to make sure that members of Congress and their staff today would be coverage for the insurance that they receive today. There's a bit of irony in that, isn't there? And so it's my understanding that we're going to have to go back and have a fix to include people that should have been covered today would be covered. But make no mistake about it, the people who wrote the bill exempted themselves as well as the executive branch.
And the executive branch as well.
The gentlewoman knows that I am interested in this. I do not receive insurance from the government. So I am not a part of that plan, but fair is fair. And we should not be making mistakes like that. But this is what happens when you hastily put things together and don't allow the light of day and let people see that. And I will hold them personally accountable and responsible. And I thank you, gentlemen.
Congressman's session is